Hi everybody, Dr. Muse here, and I'm going to talk a little bit about our topic for this week, which is something that I worked with a good amount over the last decade of my life, working as an athletic trainer, and that is ankle sprains. So for this first video, what I want to do is cover the different types of ankle sprains and shed some light on that so that we know what we're talking about when we move forward through some of these videos. So the first type of ankle sprain that we most commonly see is what's called a lateral ankle sprain. And when we say lateral, that means the outside of the foot. So what we have is the fibula, the small non-weight-bearing bone of the lower leg. And then we have the talus, which sits and fits itself up underneath the tibia, the big bone of the lower leg and the fibula. So the talus, through motion, kind of glides and slides through that what we call talocrural joint, which is the ankle joint. So the most common ankle sprain, the lateral ankle sprain, we have a couple ligaments that we're concerned with here. The first one being what's called the anterior or front talofibular, talus, fibular, fibula. That is the most commonly affected ligament. So when we step off a curb and we roll our ankle, that's a common way that we're going to injure that. We have the posterior talofibular, which is similar, just on the back side of the ankle. And then we have the calcaneofibular, which is actually the calcaneus, your heel bone, to the fibula. So we can have varying degrees of lateral ankle sprains where we may affect one, two, or all three of those, and then varying degrees in terms of how severe. Is it just a sprain? Is there an actual rupture of the ligament? So that is what we're going to most commonly see when we talk about ankle sprains. We may also hear the term high ankle sprain. Now, when we're talking about high ankle sprains, that's a completely different injury. So the high ankle sprain is more concerned with what's called the syndesmosis, or this kind of fibrous tissue that connects the tibia to the fibula. And then some of the ligaments, like the anterior tibial fibular ligament, which sits on the front of these two bones, and the posterior tib-fib ligament. So the way that we're going to get the high ankle sprain is typically from dorsiflexion, or like the toes coming up, or if we have a planted foot and we bring the leg over it. And what happens is that talus pushes up in between these two bones and separates them, therefore injuring that syndesmosis there. So that may be a little bit more serious of an injury. Recovery time is going to be longer. And the way that we're going to go about treating that one is going to be a little bit different. So those are the two main areas that we may have an ankle sprain. You can also have a medial ankle sprain, but that one's much less common due to a number of reasons. But for this week, when I'm talking about ankle sprains, I'm primarily going to be focusing on the lateral ankle sprain, the one that we see a lot. So stay tuned, watch some of the other videos for some answers, and hopefully you guys get some good information from these. Thanks, guys.